interesting morning. We don't have any power here, so Danica's taking the reins as far as the tech goes. But I just wanted to introduce Doctors Taylor Logan and her awesome husband, and they are chiropractors that are out of Colorado Springs with Live with True North, right? Live with True North. They are going to be talking about chiropractic care for mom and baby today, which is such an integral part of wellness and being able to thrive postpartum. So they're really active in the birth community out there and serving whole families. So they're a wealth of knowledge, and I'm so excited that they're on here and going to be just teaching us today. So if you have your note-taking thing downloadable, then please go ahead and pull that out. You're going to want to write down what they have in store for us.
Awesome. Thanks, Kirsten. We're super excited to be on here and to share with you guys today. We'll just talk a little bit about ourselves first, and then we'll get into it. But so like she said, I'm Dr. Taylor. This is Dr. Josh. We are the owners of True North Chiropractic in Colorado Springs, and husband and wife team, so that's super fun. We love getting to work together every day. And I think it's cool because we bring a lot of different diversity to the different people that we see too. So our family is very much involved in our practice too. Our two little girls are in and out of the office on a daily basis. We have a 20-month-old and a 6-month-old now. And so they make our practice a lot of fun and very family oriented. And so we love that part of it. But we went to school in Port Orange, Florida to get our doctorates. And then after that, we practiced in Alabama for a period of time before we moved out here to Colorado Springs. So we're loving the Springs and getting to serve the population here. It's a very family-friendly population. We get to work with a lot of pregnant moms and postpartum moms and babies and families. So that's a huge passion of ours. And so we love that we get to do that with our practice. And we definitely have a big passion for postpartum moms, me being a 2-time postpartum mom now, and just getting to experience that. I think it's just put a whole nother line on it now that we've been through that. We cared for a lot of moms and babies before we had kids, and we loved it, but I think there's just a different perspective when you actually walk through that journey and you're actually physically and mentally and emotionally experiencing that. That has brought a much different light to what we get to do. And so I think it's increased our passion for that and helping women navigate this motherhood journey. And so we're really passionate about that. Pregnancy, the postpartum journey, pediatric care. There's just so much that goes on postpartum, and that's so much that's already kind of coming at you and so many added stressors that if we can help make sure that the body's functioning optimally through that, it just helps all of that as you're in that healing journey. So we're excited about talk about that today.
Yeah, and so especially as we dive a little bit deeper into kind of even what we're going to be talking about with the course, we're going to be sharing briefly kind of what we're going to be focusing on through the course here today, but then diving into some things that we really specialize in also. But one thing we're, like Dr. Taylor mentioned, we're so passionate about is just education. When it comes to chiropractic, but then also from pregnant moms to babies, but then also postnatal care, not many people know that that is an option. When people think of chiropractic and babies, they're like, I have no idea that a baby could be adjusted, or I didn't know a pregnant mom could be adjusted. We really want to just educate to where people can understand more about what that looks like. So especially as we dive into kind of some of the topics we're going to be focusing on just within the course, the number one thing that we're going to start with is just what is chiropractic. Not many people understand that we specialize and focus on the nervous system, getting the body into the most optimal state for you to function as optimally as possible. And especially if you're pregnant, carrying a baby, we want to make sure that not only mom's functioning well, but baby's going to be functioning and healing and growing to where it's going to have a wonderful growth, but then also wonderful labor and development too. One of the things we're going to be focusing also is how does chiropractic work? What are we doing? The research behind it, how is it helping mom, but then also baby to function as optimally as possible? But then also how it can benefit mom through the whole postpartum journey. Just being able to be my wife's personal chiropractor has been a wonderful thing. Her to be my personal chiropractor, even though I've never been through a postpartum journey, just kind of came from her, but being able to kind of guide you through what that process, what that journey looks like. And a very important thing too is we have people that are on this call that are all throughout the United States, and we want to help guide you to know what to look for when it comes to basically a chiropractor that's going to be the best fit for you. So we're going to give you some tools to be able to know how to look for a chiropractor that's going to specialize not only in pregnancy, but even postpartum care, but also for your little one too. And also we're going to be focusing on some extra bonus modules also. So that's going to be for pregnancy. So we're going to be showing you what does it even look like to be adjusted from a pregnant mom standpoint, how important it is throughout the whole pregnancy process, but then also what it looks like for baby to be adjusted as well. It's very different compared to what it would look like for a pregnant mom. Oftentimes for baby, it's about putting the amount of pressure as it is putting a contact in your eye or checking the ripeness of a peach or a tomato. So gentle and specific. And so our biggest goal is to make sure that you are getting as educated as possible to make really informed decisions about your health, but then also your baby's health as well.
So all those things we're going to dive deeper into when the modules are released. And I think we're going to talk about that at the end, but coming up here soon. But for today, we're just going to dive into some things that we really love and like to focus on in our practice when it comes to motherhood.
And so really what we're going to start with is really pregnancy and pregnant moms. One of the things that we specialize in and have specific certifications in is the prenatal process for mom. As you guys know who have had babies, is your body changes so much. Just being able to see my wife go through the whole process, not only hormonally, but basically biomechanically too. I actually have like a pelvis here, and it just shows, like, especially as mom is growing a baby, the pelvis is having to adapt to that. Your center of gravity is having to adapt to that. And so really the biggest thing is making sure that we're getting mom biomechanically into the best position to hold baby. But not only that, neurologically, we want to have mom's nervous system functioning as optimally as possible, because one of the things that many women don't think about is in between each of these segments here, there's nerves that are going directly to the uterus, going directly to the ovaries, going directly even to the baby too, that if there's irritation at these areas, then that's going to lead to really dysfunction from an organ level, but also to a physical level too. If we even look at a lot of the statistics, a lot of women experience lower back pain. That's one of the number one things that we see here in the office. But a big thing too is being able to help mom go through a very efficient delivery process. I don't want to say easy, but an efficient process with that. Even if we look at the research, I'm a big research guy. When it comes to first-time moms under chiropractic care throughout the whole pregnancy process, it actually reduces labor times by up to 24%. And then for basically moms who have had multiple babies, from 2 to 3 births, it actually reduces it up to 33%. And so if you think about moms who have had more babies than that, that percentage just keeps going up and up. And I know for my wife, it was a very nice thing to have a reduced labor times for that, but also helps reduce labor pains very significantly too. I actually adjusted my wife throughout the whole labor process. And it was wonderful. Miss Danica was able to be there with us through our second birth, and it was wonderful to have her a part of that. And you can even tell a little bit more of your story too.
Yeah, and just kind of going back to making sure mom's nervous system is functioning optimally. All those nerves down there, like you said, are controlling the reproductive organs, but also there's a lot of nerve control even to placenta. So making sure that mom's functioning optimally so that the placenta is giving everything it needs to for baby's nourishment and development is so huge. So there's all these little intricate layers into, I mean, you guys know, like the woman's body is so incredibly designed to be able to grow this baby and develop this baby and carry this baby. And so you just want to make sure that everything is optimally functioning as best as possible, so that as the baby's growing, being delivered, and then when baby comes, you're setting yourself up to have the best postpartum journey as possible. And I feel like a lot of that does start with the pregnancy. But for me, I'm so thankful for chiropractic. I mean, we had we're blessed to have beautiful pregnancies and deliveries with both of our girls. I attribute a ton of that to chiropractic care, along with a lot of the other things that we did to make sure we were prepared. But I was adjusted throughout the whole process. I had very little aches and pains through that, which made it really easy to function well, to work up through our labor. And then just to be able to make sure that the labor and delivery was going to go as well as possible. There's a lot of things to that you don't get to control. And so we were just really adamant about making sure we could do everything we could control to have the best outcomes possible. And so with our first, we ended up having a 3-hour labor and delivery. I attribute that to chiropractic care, hands down 100%. He adjusted me, which is what put me into labor. And then with our second, it was a little under 2 hours of active labor, again, being adjusted, but then also making sure that everything was just in optimal positioning, including baby and including my pelvis. And I know for a fact that made a huge difference. And, that set me up, I felt like, to have the best postpartum experience possible, because I feel like that a lot of things through the labor and delivery process affect what your postpartum healing journey is going to be like. And so knowing that I was able to start off that postpartum journey in a good place, because physically I was doing well, and didn't have a lot of complications, and things happen, and we get that. A lot of people don't have that experience. And so there's also things obviously that you can do during the postpartum journey to help if you haven't had the optimal labor and delivery. And so we'll kind of go in and talk about the postpartum process, but obviously then after baby comes, there's a lot of aches and pains of your body returning back to that pre-pregnancy state, right? So many changes took place during the pregnancy process, center of gravity changes, and I mean, even just like weight gain from building this beautiful baby, and extra stress on the joints and the relaxin that's going through your body, making everything move and loose. And so all of this after pregnancy is trying to return to this almost like new normal state. And so there's a lot of aches and pains that come along with that I was super thankful to have chiropractic care through. So physically, yes, it's huge on that return, but also there's so many extra stressors and demands on the body now. You're trying to breastfeed and nourish this baby. You're carrying this baby. You're sleeping and laying in weird positions just to keep the baby quiet and asleep and not wake them up. And I know for me, I had so much, you go from having like all this low back pressure and tension to now everything's up here, to where your shoulders and your neck's aching and your back's killing you because you've been nursing this baby all day. And so making sure that you can keep your body in optimal position so that you can continue to take care of that baby properly. You're also going to be very emotionally drained and lacking sleep. And so last thing you want when you're constantly getting up with the baby in the middle of the night is to then not be able to sleep because physically you're in pain or discomfort. You want to be able to sleep when baby's sleeping. And so making sure that you may not, again, be able to control every outcome, but the outcomes you can control, you're able to address and take care of. And then just, all these extra hormones trying to return to balance. Again, chiropractic care can really help with that, making sure those hormones are balanced properly. Returning to that balanced state is something that making sure your nervous system is functioning properly can really make a big difference with. And so again, all these extra external stressors added, hormones levels raging, trying to breastfeed, body changing again, lack of sleep, depending on what your labor and delivery was like, you might have a lot of emotional trauma attached to that as well. And so making sure that those things may not be able to be controlled, and especially if you're a new mom trying to adapt to that learning curve, but knowing there are things in your control physically that you can do to help maybe reduce that learning curve, help take away some of the stressors on the body. Not all of them you can take away, obviously, but if you could take away some of those physical stressors, then it's really going to help catapult you and propel you forward in that postpartum healing journey. And so for me, I know that getting adjusted after our babies were born was like number one priority, because I knew that if I wasn't able to function well, then I wasn't going to be able to be the best mom possible to this newborn baby. It helped a lot with breastfeeding for me. And we're going to dive deeper into some of these things in the modules, but overall, I cannot recommend it enough. There's a lot of different things that are beneficial. And the postpartum journey in chiropractic care was definitely a big priority for me after that.
Mm-hmm. Yeah. And even just watching her go through so many of the new stressors after baby really played such an important role in making sure that we were checking her on a regular basis, adjusting her on a regular basis. I mean, even for example, last night, my wife fell asleep nursing our little girl, and her head was just all over the place, and she woke up and just like, oh my gosh, I am sore after that. And so obviously came into the office this morning, adjusted her, and able to get her functioning and feeling a lot better to make sure that she's, again, being the best mom that she can be for our little kiddos. But not only, I'm sure those of you that have had babies, just not only knowing that labor and delivery is an experience, it can be a tough experience for mom, but it's also can be a pretty tough experience for baby. I mean, I'm sure you all have seen labor deliveries being done at home, at the hospital, birth centers, all these things, but it can have a lot of stress on the baby's spine. There's, especially if you're looking from like a hospital standpoint, whether it's vacuum extraction, even forceps, even C-sections, all of these things can have a huge influence on the structure of a baby's spine. And there's a lot of pulling and twisting oftentimes. There was a research study done on over 1,000 babies, and they found that 80% of them had some form of a spinal misalignment after being born. And there's been other studies even showing 95% of babies having some form of a misalignment. And it's so honestly important for us to be able to get babies checked as soon as possible. Dr. Taylor, I mean, it literally saved her life as a baby. A couple hours after being born, she was at home birth in the middle of nowhere, no hospitals around, and she stopped breathing. Everything that they did from resuscitation, from the midwife, everything wasn't working. And thankfully, her dad's a chiropractor. He just graduated from chiropractic school. He checked the very top bone in her neck. And if you guys know anything about that, the brain stem sits right in between that top bone, which controls all respiratory centers. Her dad checked her neck, her atlas, the very top bone had shifted significantly. He had gently adjusted her, and she immediately started breathing again. And so, such a huge passion for us because it literally saved Dr. Taylor's life. And so if even just a slight pressure on the brainstem is going to cause potentially her to stop breathing, imagine a little bit to other organs in the body as well too. And so we really love getting to be able to check babies really as soon as possible after the birthing process, because we know if a baby's nervous system is functioning as optimally as possible, it's going to really start that baby's life on such a good fast track to overall health and wellness. We've seen so many amazing just health transformations in our office, just with babies coming in with colic, with ear infections, constipation, trouble sleeping, trouble nursing. All of these things can be tied into really how the nervous system is functioning, but then also structurally how the spine is moving and how it is functioning to where it could be causing irritation onto the baby's nervous system and overall body as well too. And so being able to make sure that baby is healing and functioning as well from the start is going to prevent so many other health challenges down the road. And so important to be able to make sure that we're doing well with that.
Yeah. And one of the biggest things that we really focus on is the fact that if baby is having a rough start to life, that's obviously going to affect the postpartum healing for mom as well. And so if we can make sure that baby's functioning optimally, and there's again so many added stressors that if we can reduce a few of those, so that mom has the time and the energy to heal properly, then that's going to set honestly that baby up for the rest of their life too. And so that's super important to us. And Dr. Josh actually adjusted our babies when they were less than 2 hours old, both of them very what we thought were straightforward, non-complicated, natural home births. and both of them had spinal misalignments. And you've got to think there's just when baby's descending through that vaginal canal, there's a lot of pressure with the contractions, and so oftentimes it'll shift those babies' spinal bones out of alignment. And so he adjusted our babies just after they were a couple hours old, which I was super grateful for, and thankfully we've been able to avoid a lot of issues that we often see with newborns. But just to kind of end, I want to share a little bit of a story that we had recently in our office, and how big of an effect the newborn can have on a mom's postpartum journey. But a little baby came into us a couple weeks ago. I think he was 3 weeks old. And he was not nursing well. And when he did, it was very, very painful for mom. And thankfully, they had gone through lactation consultants and gotten some really great advice, and things were helping. And they ended up having to do some lip and tongue revisions, which was helping. And so baby was thankfully nursing better, but there was so much pain with nursing. And when she came into our office, we were kind of the last thing that they told her, the lactation consultants ordered to check us out, but she was basically ready to just give up breastfeeding. It was just too painful and too stressful, and first time mom, all of that added on to the already huge emotional stressors and physical stressors she's dealing with. It was just too much for her. And so she came into our office, and we actually found that the baby had a very severe misalignment in the top bone in his neck. And so we adjusted him right away. That day he latched for the first time pain-free. She said his whole 3 weeks of life, she had never been able to nurse him without excruciating pain. And so just think of psychologically what that's doing to mom too, associating this pain with the nourishment of her baby. And so, he's been in for a few adjustments since then. He's now latching amazing. She's had virtually no pain at all anymore with that. And so we were just super excited that really was the final piece of the puzzle to help save that breastfeeding journey, and what that's going to do for not just the bonding for mom moving forward with baby, but just the nourishment for baby and getting to do what her desire was moving forward has had such an impact in her healing with that postpartum journey. And so I'm excited to see how that continues to go, but just wanted to share that story and show how little things like that can affect the mom in big ways. So we're excited to share more when our modules come out, but that's all we have for you guys today. So I'll hand it back over to Kirsten or Danica.
Thank you so much, guys. That's such a cool story to hear, how your dad literally saved your life. Dr. Taylor, that's so cool. I knew when we were creating this course too that we had to have chiropractic involved, because it was something that changed my mothering journey. I literally had never done chiropractic care at all until I had my son, and he had a lot of tightness on his right side, so he couldn't even turn his head properly to nurse. So it's good your husband walked away, because I had one really big engorged boob and then one just not functioning boob, because he couldn't even stimulate it enough. And I was I already had a baby. I was a postpartum doula. I felt like I should have known what was going on, but I just was baffled. And then my IBCLC told me, she was like, you need to get him adjusted. And that was my first oh wait, they can be adjusted story. So he got adjusted. The chiropractor also told us that he had stomach enzyme issues, which was causing a lot of his discomfort as well. So once we started going, he was pooping regularly. He literally would poop right after he would be adjusted, and breastfeeding was a dream after that. So every time moms are have gassy babies, I'm have they been adjusted? And so chiropractic care for mom and baby is amazing. Also, I didn't know that chiropractors can literally adjust mom's pubic bone too. That is that's new, and that helps your pelvic floor function and healing wholly. And there's just so much that they can do holistically for you and your family. That's, for us, it's non-negotiable. We go every month, and that's just a part of our health and wellness. And I'm excited to have them deep dive into our How to Thrive Postpartum course and talk more in depth about what that looks like for you and your family. So thank you guys so much. And look at your cute little girl. She's looking at mom like, Mom.
So got perfect timing.
Good job. Thank you so much, you guys. I'm gonna go ahead and switch gears now and hand things over to Jessie. If you haven't already met with Jessie, she's a functional fitness trainer. He's like, you're done, Mom. But she does a lot of functional fitness for mothers. She's amazing. And today she's going to be showing some movements and I believe like breathing techniques that you can take away today that will help you create strength and just a better understanding of your body. So we're so excited to have Jessie again. She's just that amazing. We have to have her twice. So Jessie, I'll let you take it away.
I'm going to plug in a microphone because I'm going to be standing away from the phone. Can you guys hear me? Yeah? Okay, great. Wow, sorry about that. Okay. That is close up. All right. Sorry, I had to set up this microphone. Oh my goodness. It's okay. Hey. Oh my gosh. Sorry, guys. Sorry.
That's mom life.
I've got a lot of animals, and we've got like 9 animals that live in the house, including my baby and husband and roommate. Are you okay? Yeah? Okay. Okay, so whoever wants to turn on their video so I can help guide, we're gonna go through a posture assessment, some very common core postures that I see postpartum a lot with mamas that are working with me. And then I'm gonna run through a posture assessment, because when we are looking to heal a diastasis or a pelvic floor issue, most of the time it's something attributed to a muscle imbalance or muscle compensation, poor breathing patterns, or poor posture. And so when we're looking to fix an ab separation, which is a symptom of something else, we wanted to address whatever issue that is and not just attack the symptom. We cannot just do 1,000 DR safe workouts and expect that diastasis to heal. So a diastasis is an ab separation. Basically is just the thinning or stretching of the linea alba. It happens in 100% of women at the time of delivery. So it is natural. It needs to happen to make room for baby. And so there's nothing really we can do to prevent a diastasis from happening if we are pregnant, but we can make sure that we are being aware of signs of intolerance, moving through our daily lives and our exercises during pregnancy and postpartum to make sure that we're not making the diastasis worse. Now, it doesn't just include pregnant mamas that can get a diastasis. Children have it when they're born. You'll see if you have a small baby or child at home and they lift their legs when they're laying on their back, you'll see like a doming or a ridging of their little belly right down the midline. And that's because they just don't have the abdominal strength to control the pressure in their belly when they're lifting their leg. And so they get that little ridging. Now, men can get it, or women that have never had babies before, and women that are extremely fit can also get it, because we get a lot of side tension. A lot of people want to work those obliques and the side lateral abs. If those abs get very, very tight, what that does is that pulls on that separation. And so they may have very, very defined abs, but they can still have that separation in their belly because we've got very, very tight lateral abs. So pelvic floor issues like incontinence are basically a pressure issue. And the same as diastasis, it's a pressure issue, a hernia, and pelvic organ prolapse. You are not regulating your pressure correctly and effectively with the muscles that you're trying to recruit when doing any type of exercise, or mostly it's because of what you're doing in the other 23 and a half hours and not just the 30 minutes of exercise. So what we're gonna do is we're gonna go through that posture assessment, because I'm gonna show you some bad postures here. Am I talking very loud? I'm trying to like talk to the camera, but then I forget that I have the microphone on. Is it okay? Yeah, okay. Okay, so the first poor posture that we see a lot in mamas is and not just in mamas, just a poor posture in general, is an anterior pelvic tilt. So you've got, it looks like my butt is sticking out a lot. I've got a lot of forward pressure into my belly. My ribs are flared and thrusted forward. My chest is pointing up towards the ceiling. And whatever you do to one end of the spine, you're gonna do to the other. So if this end of my spine is flipping out, this end of my spine is gonna be flipping out. And so my chin is towards the ceiling as well. So we see this a lot, especially when girls are trying to look good, walking, strutting their stuff, sticking their butt out. What happens when we get stuck in this anterior pelvic tilt where the pelvis is dumping forward, as you can see, my knees are driving in. My feet are flat. I've got all that pressure into the front of my belly. Intra-abdominal pressure, which you create with your inhales and exhales, happen during every single movement that we make. And it's gonna take the path of least resistance. So postpartum, the path of least resistance is gonna be our belly, and it's gonna be our pelvic floor, because we just grew a baby in our belly, and then overnight that baby has been delivered and we're all stretched out. There's no way to regain that connection overnight. So if we're taking, that's why I don't really like the idea of belly breathing after your baby is born, because we don't wanna put any more stress and more pressure into a place that is already stretched, already is overextended. So what we want to shoot for is a 360 pattern breath. So you want to get expansion in your back, expansion in the front, expansion laterally. So your ribs are like bucket handles on your spine. They attach to your spine and they attach to your sternum in the front. And they move like this. Inhale, expand, exhale, come down. If I'm stuck like this, my ribs are flared forward. I'm getting no back expansion because all this pressure is going out to my belly and my back is compressed. Those paraspinals, those muscles in the back are very, very tight. And so if you've got a lot of low back pain, this could be why, because you're compressing and squishing all those facets and all of those discs in your back. We also get the inward rotation of the femurs, which makes it very uncomfortable for the pelvic floor, and you end up with very weak glutes. It might look like my butt is sticking out because it's so big, but what's really happening is if I'm walking like this with my feet internally rotated, I'm using a lot of quads. My quads here are shortened because instead of standing upright, I'm tilting forward. I've just shortened that quad, and the hip flexors are very, very tight. So I'm not using my glute muscles to walk forward, to squat, or anything like that. If you're squatting and you're coming in with your knees, you're not using your glutes. So the other posture that I tend to see a lot of, and you can spot people doing this out in public, is tucking the pelvis. So a posterior pelvic tilt is the backward rotation of the pelvis. So dropping the tailbone, clenching the butt cheeks. So you end up with a wedgie at the bottom and maybe an overdeveloped glute medius. So you'll see like an overdeveloped glute muscles at the top and then a tiny little wedgie and just flat butt. Mom butt is a real thing. Unfortunately, that's what we call it. Once we give birth and our butt cheeks go flat, it's because our pelvic floor is weakened. We're trying to protect our pelvic floor. You see this with dogs. If you are going to yell at a dog, what do? They tuck their tail to protect their most vulnerable place. So that's what we're doing essentially. We're protecting our most vulnerable place, which is our pelvic floor, by tucking and rounding out the pelvis on the bottom. What tends to happen when we do that is we get that pooch out in the front. So you might be experiencing that pooch that you can't seem to kick, and it could be because of the way you're standing. It could be because of your posture. So what I said earlier, what you do to one end of the spine, you do to the other. So if I'm gonna tuck here, I'm gonna tuck my pelvis, you see what's happening to my upper back. I'm gonna round forward. My head's gonna jut forward. This is gonna make it very, very tight in the chest, in the pec minor. We're already stuck in this position a lot because we're taking care of babies, because we're breastfeeding, bottle feeding, pumping, all the things. And, our core is pushing out, again, a lot of forward pressure into our core, into our diastasis. And that's what we do not want to do. And the very last, most common poor posture that we see with mamas is kind of a combination of both. You're kind of getting a glute tuck and the rounding, but what's the biggest difference is that forward shift. If this isn't a mom posture, you see moms that are pregnant with the belly, they're doing this. They've got the waddle going, so the glutes are clenched, which the glutes externally rotate the legs. So externally rotate means turn away. And then they also bring the leg away from your body in an abduction. So if I'm clenching my butt cheeks, you can stand up and do this. If you clench your butt cheeks, it's going to turn your feet outward. This makes it very, very difficult to contract the front of your pelvic floor. If you can't regulate the front of your pelvic floor, maybe you have leaking or incontinence when you're yelling for your kids, or coughing or sneezing or coming out of a squat, you're going to pick up your kids. Now, if I'm clenching my butt cheeks, maybe you don't even know that you're clenching your butt cheeks, you just hold tension there. If I go to bend over to pick up my kid, first of all, if I'm clenching, all I can do is kind of let my knees go forward, which is a lot of pressure in the knees if I'm squeezing my butt cheeks. So my knees are gonna go forward, or I'm gonna have to round my back. So I've just lost my core in both of those things. So again, we wanna make sure that we're having a nice tall posture, because right here with that forward pressure of the hips, we've got our femurs pressing forward into the hip sockets, which make those hips pretty unhappy. We've got the backward rotation of the pelvis. So our glutes are going flat, and poor glutes, poor muscle recruitment of the glutes makes it very hard for pelvic floor to function optimally, and your core. So if your core is not working, your pelvic floor is going to try to take over. If your pelvic floor is not working, your glutes are going to try to take over. Some muscle group has to be able to work so that you're going to stand upright. So what we need to do is we need to reestablish great posture, great breathing patterns, and awareness to heal our core and pelvic floor dysfunction. So if I'm here, got the forward head posture, my hips are thrusted all the way forward. This is what we're going to start the posture assessment on yourself. So if you want to stand up and do it with me, this is what we're going to do first. We're going to make sure our toes are pointed forward. That's the first thing. Now I want you to maintain an arch in your foot. Your feet are like your hands. You should be able to control all of your toes, create an arch in your foot, because if we've got shoes that are smushing our toes together, we would never just keep our hands in this position with our fingers touching 24/7. We don't get great use out of that if we're not able to move our fingers. So what I want you to do is I want you to create an arch in your foot. Take your big toe and the ball of your foot and drag it towards your heel without scrunching up all of your other little toes. So I want you to create the arch in the heel by dragging your big toe towards your heel. Now I want you to try to balance your weight between the outside of your foot, where your pinky toe is, that ball right there, the inside ball of your foot, and your heel. Your feet are your foundation. If you do not have great feet, muscles, and function, then the rest of the body is going to suffer. The feet are the foundation, they lead the way. So the next thing I'm going to have you do, we fixed our feet. I'm going to have you push your hips back and in line with your body. If I dropped a plumb line from the top of my hip bone and I dropped it straight down, it would hit the outside bony part of my ankle. Instead of being out here, if I dropped a plumb line, it would hit my toes. If I dropped a plumb line from my pubic bone, it would hit way past my feet if I'm way out here. I want you to bring your hips back in line. If I dropped a plumb line here, it would hit the middle to the back of my foot, where my ankle and my foot meet. That's what we're shooting for here. Next thing I want you to do is I want to make sure that your knees are facing forward, not turning out, not turning in. Since we've already adjusted the feet and brought our hips back, it should be a lot easier to make sure that they are straight, while making sure that your toes are also separated. Again, we don't want to keep our toes, just like we wouldn't keep our fingers completely touching and unseparated. We want to make sure our toes are nice and spread, and we have control over all of them. So the next thing I want you to do, we're going to adjust the pelvis. So whether you are in an anterior pelvic tilt or a posterior pelvic tilt, we're going to try to find neutral. Now, neutral is a little bit different for everybody, because everybody anatomically is a little bit different. So you might have a little bit more arch than somebody else, or a little less arch in your back. But we do want a low lumbar curve. That is natural. So how we're going to find pelvic neutral is I want you to take the palms of your hands, put your palm on the front part of your pelvis, your ASIS bones. It's the front bony landmark on the front of your pelvis. Now I want you to take your fingertips, find your pubic bone. So you're creating like a little triangle here. And I want you to find the place that your hand is flat. So if you are in an anterior pelvic tilt, your fingertips are going to be behind your ASIS, behind your palms. If you're in a posterior pelvic tilt, my fingers, my pubic bone, are sticking out further than my hip bones. So find the place where they are flat and level. Watch out, Bucky. Thank you, Mama. Okay, so we fixed our feet. We brought our hips back. We created an arch in our foot. Our knees are facing forward, and we have found pelvic neutral. So this might require you to drop your tailbone just a bit. You might notice you get a little bit less back pain. Or you might need to actually grab your butt cheeks and just open them, release the cheeks. No squeezing the butt cheeks while we are just standing. That's not what the glutes are for. Okay, so the next thing we're gonna do is we're gonna adjust the ribs. If you are hunched forward, your rib angle is gonna be less than 90 degrees. I want you to make sure that your ribs are not flared out or completely rounded forward. How we get this rounded forward stuck position is a very, very tight chest. So I want you to find the place that your ribs, the front part of your ribs, meet your ASIS bones. We want to stack the ribs over the pelvis to get that great core canister and great alignment. If I have my ribs thrusted out in front of my pelvis, my air pressure that I create with my inhale is going to go out and down in front of me all into my belly. And we don't want that. We already know that the intra-abdominal pressure we create with our inhales and exhales are gonna take the path of least resistance. So we do not wanna do it all into our belly. We wanna make sure that we're stacked, ribs over pelvis. Now, I also want you to make note, if you just adjusted your ribs, did your pelvis shift? So I need you to check your pelvis again. Make sure that you're still aligned. So you still got that great pelvic alignment and still have your ribs down. Next thing, I want you to put your hands out in front of you. We're gonna adjust the shoulders here. Hands out in front of you, out to the side, palms facing forward, and then drop your hands. This is a shoulder neutral. We're not pulling our shoulders all the way back. We're not letting them round forward. If you find that you hold a lot of tension and you kind of hold your shoulders up by your ears, especially while you're typing or looking at your phone, you can squeeze, 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 and then drop them. And that's also gonna help you find neutral. The next thing I want you to adjust is your head posture. Your head, just like your feet, lead the way. So you're gonna take your chin, you're gonna bring it back in line with your body. You're gonna act like there's a string pulling you up from your ponytail, tucking your chin, making you stand nice and tall. You're gonna notice, well, hopefully you're gonna notice that when you adjust your head, it kind of adjusts your spine. So you're gonna feel a little bit taller. You're gonna feel a lot less pressure on your back because you're not cramming your spine in that anterior pelvic tilt, and then you're also not cramming your spine in the posterior pelvic tilt. So you're standing taller. A cue I like to use a lot is to listen to a conversation going on behind you. So if you are eavesdropping, you're gonna stand a little taller, you're gonna tuck your chin and kind of perk up to listen to what's going on. And it kind of just makes you stand up a little bit taller. Now, the perfect neutral doesn't really exist the same for everybody, but we want to figure out a way to spend the most amount of time in that position. We don't need to be stiff and walking around in perfect posture 24/7 because that's not natural. We, especially as moms, you're on the ground, you're standing up, you're doing all the things all the time. The problem that I find is that when we get stuck in certain positions, if I've got a mama who's stuck like this and she cannot unround the upper back because she literally she's so tight in her chest that she can't pull herself out, or if she's so stuck in an anterior pelvic tilt that she cannot bring her pelvis back down to neutral, that is where we create muscle compensations. So if I'm stuck in this rounded posture and I'm trying to teach a mama how to deadlift or to properly pick up her kids, because picking up your kids right here is the same as a deadlift in a workout. This is a functional movement that all moms need to know how to do. Just because you're not doing hard workouts or lifting at a gym does not mean that you don't squat. You squat every single day, getting up and off the toilet, getting out of your car, sitting down into a chair. So we need to make sure that we have the functional movement patterns down, making sure that we do not have places where we are stuck in these poor posture habits, because that's going to create muscle compensations, which lead to muscle imbalances over time, which at some point is going to create an injury and set you back. So now that we've covered posture, we're going to go into some breath work. Now I want you to come onto the ground. We're going to get on our back. So come onto your side first, especially if you are newly postpartum or trying to heal a diastasis. I'm going to shift this camera down just a bit. Okay. So you're going to come onto your side and onto your back. I want you to put one hand on your rib cage, one hand on your low belly, and I want you to take a deep breath in. Exhale. Now I want you to take note of what moved. Did you get movement in your hand that's on your ribs? Did you get any movement on your low hand that's near your lower area of your abs, so above your pubic bone, right below your belly button? Or when you took an inhale, did your chest fill up with air pressure? Or did you only get air pressure into your belly? Did you feel your pelvic floor lengthen? If not, we want to focus on more of a 360 breath expansion. So 360 out laterally with your ribs. So you want rib movement. You want belly, back, and pelvic floor expansion, and of course a little bit of chest because our lungs are under there. So now what I want you to do is I want you to take your hand, put it on your ribs, put one on your low belly, take another inhale down to your pelvic floor. I want you to get a little bit of pressure into your hand that is low. I also want you to get expansion out sideways into your ribs. So here we go, guys. One more time, breath in. Exhale it all out. I want you to focus on an inhale for 5 seconds and exhale for 10 seconds. So whatever your inhale is, I want you to double the exhale. That is how we fire on the transverse abdominis, the deepest layer of the core system, and that works synergistically with the pelvic floor muscles. How do we know if the transverse abdominis is firing and kicking on? You can take your fingertips, find those ASIS bones, the front bony parts of your hip, find those bones with your fingertips, and then just slide right inside of those bones. Right now, it should be pretty relaxed and pretty squishy. What we are looking for is a slight build, a subtle build of tension underneath our fingertips on the exhale. If your fingers get pushed completely out of that space inside of your hip bones, then that is your internal obliques, and you've just been completely pushed out of there, an overactive internal oblique muscles. So what we want to focus on here is a slow, gradual, subtle tension building pressure underneath our fingertips. So inhale down for me. Exhale, feel that tension build. Every last ounce of breath out of your body is going to really help kick on the TAs and the pelvic floor. A forced exhale is how we get those muscles to fire on. So I'm going to run you through a couple of exercises that I like to do with mamas postpartum. Now, this is going to completely depend on whether you have been cleared to work out. ACOG has stated in their new guidelines that mama is able to join back in pelvic floor and gentle core exercises as soon as she feels ready. So it's not necessarily the 6 to 8 weeks postpartum that you have to wait to start working out again. But again, you want to make sure that you have your doctor's approval and that there isn't a complete contraindication that you cannot start working out again. So let's get down on the ground one more time. Here we go, guys. We are going to go into a glute bridge. I like to do this workout with you mamas because we're strengthening glutes, which in all of the poor postures that happen postpartum, your glutes are underactive or clenching. So I want you to make sure on the exhale, when we're lifting pelvic floor, that we are not squeezing our glutes, because the glutes should not initiate pelvic floor contraction. So we're going to inhale down, exhale, close all 3 openings that you have beneath you. So we're going to close the back passage, middle, front passage, lifting the lower abs, slowly contracting until the upper, bringing the ribs down with the external obliques. And then we're going to kick on the glutes, lift up, and the knees are going to drive over the toes and outward, because our glutes are external rotators. So they're going to externally rotate the legs while we do our glute bridge. Inhale, come down. Inhale, right here. Exhale, lift. What we're checking for is engagement throughout our core the entire time as we are lifted. Are you dropping here and you're getting a doming or coning or sinking of your core, your linea alba? This means that you're not engaged in your core. You want to make sure that you've got pressure all the way down, all the way up, that your ribs are down, and that you're in a straight line and not having your butt drop or overarch to now we're creating pressure in our upper belly as well. So just a couple things to take note of. You can also put a weight on your pelvis to do this. You can put a band around your legs to do this. You can make this a lot harder in a lot of different ways. If you've got, let me grab a resistance band. This is a really great one too. If you've got a ball or a pillow or anything that you can squeeze, we can put that in between our legs and work the glutes and the adductors at the same time. The adductors are those inner thigh muscles that are connected to our pelvis and our pelvic floor. If you've ever had the urge to cross your legs when you are about to sneeze or cough, that's because they are directly related to our pelvic floor. They help support the pelvis as well. So here we go, guys. Inhale down. Exhale. Squeeze the ball with those inner thighs. Squeeze the glutes to lift up. A forced exhale with a hissing or a ha noise makes that TA, that transverse abdominis, kick on with the pelvic floor. So now we're tight and contracted all the way around, so you can poke your side belly to make sure that everything is firing. Poke inside of those hip bones, make sure you're nice and contracted there. Inhale, come down. Exhale, lift. Squeeze the ball. Come down, inhale. So you want to make sure when you're doing this that you are first lifting from pelvic floor, then contracting the lower abs, then contracting the middle, then the upper with the external obliques and those ribs coming down. What I want you to be really, really careful of is having that lower belly puff out at the end of your exhale. So you can take your hand and put it on your low belly. Let's say I'm going to come up into this bridge and I'm exhaling. At the end of my exhale, I push too hard and my belly at the bottom puffs out because these external obliques are too strong, too overactive, and we're not balanced in our ab muscles. So I get this gripping and I get a poof at the end. That means I'm putting a lot of pressure into my pelvic floor. So if you have a heaviness, or you experience leaking, or you experience your prolapse getting worse, I want you to be really aware of what your lower abs are doing, because you could be just putting a ton of pressure in there by trying to get too strong of a contraction with the top abs. So let me show you guys another one from a different position. So there's a ton of stuff that I have on my Instagram that are great workouts for moms postpartum as well that are very gentle. There's a ton of exercises. It really isn't about finding DR safe exercises or postpartum safe. It's really about the way we execute the exercise. Do we have great alignment? Do we have great breathing patterns? Do we have great recruitment of our core? Are we aware of intolerance signs? So that bulging or that puffing out of our linea alba, can really be a sign that we're not recruiting those muscles correctly. So let's get into a hands and knees position. You can take that same pillow or ball or whatever you have, put it between your legs. We're gonna go into a bear plank. So instead of being fully extended into a full plank, we're gonna chop it in half. This makes it a lot easier to regulate that core pressure. So what we're gonna do is we're gonna inhale 360. So I want pressure into your back, into your ribs laterally, belly, and pelvic floor. Here we go, guys. Inhale. Exhale, squeeze the ball. Lift your knees off the ground. Now, what I don't want to see is this. So arching my back, putting my butt up in the air. What I don't want to see is shifting forwards or shifting backwards. And I also don't want to see your chin coming up or hanging way down. So again, we want to keep that chin nice and tucked. Head is in line with the spine. And squeezing the inner thigh, squeezing the ball is really going to help fire the pelvic floor. So you might find this a whole lot easier to do with the pillow in between your legs or that ball than doing it without, because you're getting that extra tension, extra build of engagement for your pelvic floor. So again, closing the back passage, closing the middle, closing the front on the exhale first on pelvic floor. Here we go, guys. Inhale down. Exhale. Squeeze the ball. Come down. Inhale. Exhale. Lift. Squeeze the ball. Chin is staying tucked. Head is staying long. We're not getting any shifting. We want to imagine a glass of water on our back. And we don't want to spill a single drop. Okay, great job, guys. You're gonna take that ball, you're gonna take that pillow. We're gonna move on to a side plank with a ball compression. Now, we train a lot in side planks rather than front planks because front planks put a lot of forward pressure into our belly. When we're trying to heal our core postpartum, we don't wanna put a lot of forward pressure into our belly. So we're gonna work the lateral abs. So the transverse abdominis runs from front to back in a horizontal fashion, unlike the six-pack muscles that run up and down of the front. So what we're gonna do here, we can go into a modified side plank. So having the bottom leg bent, we're gonna push up with that knee by squeezing that bottom glute. And then we also wanna make sure that we're not falling into our shoulders. We wanna push through that scapula, pushing away from the ground. Again, keeping our head and in line with our body, not letting our head hang down or letting it come way forward. What we're gonna do is we're gonna inhale down still. Exhale, lift pelvic floor, lift the core. And we're gonna press into that ball. Now we're getting a little bit of feedback from this ball. We're able to generate more tension and more engagement by squishing that bone. We're gonna feel a lot more tension in our core. So here we go, guys. Inhale down. Exhale, lift pelvic floor, lift the core. Exhale audibly, so making a hissing noise. Squeeze that ball, press it down. Now you can take this hand and feel the bottom side of your core canister, and you should be pretty tense here. What I don't want to see in your side plank is you tilting and arching backwards, letting those ribs flare open. We don't want to put tension on that connective tissue in the front. So keeping everything a little bit towards the ground, not much, but you want to be engaged here. Inhale, come down. Exhale, lift pelvic floor, engage the core, push that ball down on the exhale. Now, your upper traps on the arm that's on the ground should be nice and squishy. So you can feel up here, everything should be squishy. Your back should be squishy. If it's not and you're arching forward, we want to make sure that that's not happening, that just your core is engaged here. Come down. Inhale. Exhale, press into the ground. Great job, guys. Let's do the other side for 3. So have that bottom leg bent. Again, not falling into that shoulder, so pushing through the ground and then pushing into that ball. Here we go, guys. In 3, 2, 1, inhale down. Exhale, press. Inhale, come down. Exhale, press. Now you can add on to this. You can throw a band on around your knees and add a little leg lift. You can do it without the band. And what's really cool is with these side planks, we're also getting a great glute workout for that bottom glute. I'm telling you, if you hold this position, that butt cheek is gonna be on fire. So we're getting lateral abs for the transverse. We're getting those shoulders working because we don't wanna be rounded forward. So we're making sure that those shoulders are working in this. We're getting our core engaged with pelvic floor. And we're also working those glutes. You throw a band on over your knees, get a little leg lift. Now you're working the top glute too. So this is a great exercise to do. If you do 10 on each side for 3 rounds, and that's all you do, you're getting a great full body exercise. So the last thing I want to go over, I don't even know what time it is. Let me see. Doesn't tell me what time it is. How is that possible? I cannot see what time it is. How many more minutes do I have, Danica? 5?
It's 12, but I think you
5?
can keep going. You know, people
I just
can
want
hop
to go
off
over
if
one
they
more
need to.
thing. And I guess I don't have to have my microphone in, so let me plug. Okay. So yesterday, when I talked about tension, holding a Kegel the entirety of your run or your workout, when we hold low-lying levels of tension in the body, those muscles become not functional because it's not moving through their full range of motion. So if I'm holding my arm out for 2 hours, that arm's not going to get stronger. My body's going to start doing weird things to make sure that I can keep that arm up. Yes, honey. Hold on. I got 5 more minutes, okay? Okay? We're upset. Come here. So I just want to show you guys a tension, what tension that you're holding can do to your pelvic floor without you maybe even knowing or realizing that you're doing it. So what I want you to do, everybody, with your mouth closed, I want you to tighten up your jaw. So bite down. If you're sitting, this works too. Sitting, standing, doesn't matter. So bite down on that jaw. I'm not asking you to do anything else. We're just biting down. Now everybody keep biting down. I want you to feel your core while you're biting down. And what do you feel? If you are tight and tense, I didn't ask you to contract your core. I only asked you to bite down on your jaw with your teeth. So what you're doing with your jaw directly affects what's happening with your core. Your core is directly connected to your pelvic floor. If you are somebody that is type A, or if you are somebody that is under a lot of stress, or if you're a mom, because moms are stressed out, you might be tensing up your jaw and not even knowing it. And you're causing a lot of tension in your core. You're causing a lot of tension in your pelvic floor, holding tension there. If you are a glute gripper, if you are tightened up with your butt cheeks all the time, your glute function is going to go down. Now, why do we have that glute tightening and gripping going on? Probably because there's some sort of core and pelvic floor dysfunction. Now, why do we have that going on? Maybe because you're holding tension in your jaw, and over time, a low-lying level of tension causes dysfunction and muscle weakness, because a very, very short muscle can become weak, just like a very, very long muscle can become weak. We need to find balance in the middle. So if you've got very, very tight hip flexors, which is the front part right here, the front part of your, I don't know about that. She's hanging onto the back of my chair like a monkey. Are you okay, Buggy? Yeah, okay. So I just wanted to show you the relationship between the floor of your throat. We have 3 diaphragms in the body, not just the diaphragm the actual diaphragm muscle, but our pelvic floor is also a version of a diaphragm as well as the throat. So if you ever need to ramp up energy or ramp up contraction, you bite down on your jaw. If you're doing something that's very hard, what do? You bite down on your jaw to gain that tension and to gain, or if you're doing a side plank and you've been holding it for a long time, what do? Squeeze your hands together. You close those fists and create tension throughout the body. What is happening back there? So what I like to have my mamas do, because we tend to let these things slip our mind, is to create some sort of reminders. So put Post-it notes up. Create a reminder in your phone to go off a few times a day, just to relax the glutes, just to relax the butt cheeks. Because if you are tense all the time, those glutes are gonna go down in function. They're gonna become more flat. Your pelvic floor is gonna become overactive. So if you have a hypertonic pelvic floor where your pelvic floor muscles are very, very tight, you experience painful sex because nothing is able to enter the pelvic floor, or if you experience leaking, or if you feel like you can't get a good contraction in your pelvic floor, it could be because you are already currently contracted. So if I'm here all the time with my bicep, if I'm just, this is my resting tone right here, how am I going to get a good contraction from here? So if I need to lift something, I can't because I'm already contracted. I'm already in my most shortened state. So we want to make sure we would never keep our arm bent like this all the time. Just like we can't really do anything with our bicep that's completely lengthened. So that's what's happening in our upper back. If our back is overextended, totally lengthened, I can't do anything with that if I'm going to be stuck there. Those muscles aren't working. They're not strong. They're totally lengthened. In the same note, if I'm rounded forward, my pec minor muscle, this like rope chest muscle in the front, gets very, very tight on mamas. We're stuck like this. You can't use this muscle now because you're not able to open and move that arm because you're stuck here. So a very tight muscle can be weak. A very long muscle can be weak. Just like if you have no muscle tone in your pelvic floor, that's a weak pelvic floor. If your pelvic floor is so tight and so contracted all the time and you can't get a good inhale down, if for some reason you've got a lot of pressure that builds up and pushes down, that's how we create pelvic organ prolapse. That's how we create incontinence, urinary and fecal incontinence, because we're already so tight that if for some reason we need to be able to contract and support ourselves, we can't. If any type of pressure comes down on here, they're already so tired from being contracted that they just give out. Something has to give in the pressure system within the core canister. Sometimes that's a hernia in your linea alba. Now you can get hernias in your groin. You can get a hernia here. You can get a hernia out of your pelvic floor, pelvic organ prolapse. You can get a diastasis, which is basically the precursor for a hernia if you're not careful. You can get a hernia up into your diaphragm. So somebody that has a lot of heartburn, acid reflux, they might be holding a ton of tension in their pelvic floor, in their belly, and so the only place for that pressure to come up is back up through that diaphragm. If you're not able to descend down with your breath, it has nowhere to go but up. And so we want to make sure that we just create more balance throughout the body, make sure that our muscles are able to move through their full range of motion. Breathing has to happen in a 360 pattern, front to back, side to side, and the diaphragm works with the pelvic floor. On the inhale, everything goes down and lengthens. On the exhale, everything comes up, back to the resting tone. Now, resting tone is different from the contracted state. If I need to sneeze or I need to cough, I'm going to give myself a little bit more of a contraction to support my pelvic organs. So I'm going to do a little Kegel, and I'm going to lift, support myself a little bit, come back down to resting tone. Now, if I need to bear down, if I need to push a baby out, if I need to relax enough to have a bowel movement, I'm able to then lengthen. So we need to have this full range of motion because the pelvic floor especially is in charge of a lot of body functions. And so we don't want to be in a contracted state all the time or in a fully lengthened state. We want to just make sure that we can find that neutral space. And the same thing for our posture, not holding a stiff, perfect posture 24/7, but having the ability to get in and out of certain positions and come back to neutral. That's what we're shooting for. So I still don't know how long I've been talking, but that's about all I'm going to ramble on about. So thank you so much, guys, for having me and doing my little workout and listening to my posture assessment and all of the things. Thank you so much, guys.
Awesome. Thank you so much. That was very informative. And I like the visual of seeing how your pelvis is tilting with the
And now I can't hear you.
Oh, can you not hear me?
How weird. I cannot hear.
Can everybody else hear? Okay. Well, Jessie, I love you, but we're just saying thank you. But Jessie, like I said, is going to be in our Thrive Postpartum course. She's going to have her very own mini course. So that is exciting. She's going to have workouts in there and a lot of her talking to you. So really informative and awesome. Thank you, everybody, for rolling with the punches today. Hi, honey. I know my son is over this too. So, but thank you, everybody. I hope you have a great rest of your day. I'm really excited for tomorrow. Tomorrow is going to be Shannon Kaufman. She's a mental health counselor. She's going to be talking a lot about mental well-being, and then it's going to be me. So I'm going to be talking about shedding mom guilt and working through feeling shame as a mom.